The third day of the Africa Health Indaba is taking place at Gallagher Estate, where it serves as a platform for hosting discussions on regional collaboration in healthcare. The gathering aims to find solutions to optimize limited resources and facilitate cross-border sourcing of healthcare, especially in the light of the mobility of the African population. One of the exhibitors this year focusing on scrubs that are child-friendly. Let's cross live to SABC News' reporter Patricia Visagie, who's been following this story. Patricia, this is so important, isn't it, given concern about the state of our hospitals, about the influx of people from other African countries? How do we deal with this on a national level? Just tell me more about the discussions.
Well, definitely a very important conference that's taking place here in Midrand, bringing together some of the greatest medical minds, scientists, and of course also delving into the economic aspects. All of this to consolidate information that will obviously improve the future of African health and make sure that it's world class, but also to tackle the various challenges that the African health systems are faced with. A lack of resources, funding, political will to bring some positive changes that will actually benefit the people on the ground, having taken the impact of the COVID-19 pandemic into consideration. Of course, these health aspects are also, experts rather, also looking at what could be better, what improvements can they obviously bring to the fore should the globe be faced with another big health crisis as we have seen with the COVID-19 pandemic. What changes can they make? Will the world be ready? Will Africa be ready? We've heard some of the, of course, calls that have already come out of this conference from some of the experts saying that Africa has to obviously be at the front line of manufacturing its own health products. And that's why we're actually back here in the exhibition hall, where many of the exhibitors, of course, from across the globe, not just Africa, they're here to showcase some of their products. And this goes to the heart of this conference, which deals with sustainability and, of course, innovation. Just to show you maybe some of the stalls that are here, just to give you a glimpse of what is happening here. Of course, we delving into one of the exhibitors, and they're dealing with scrubs, innovative scrubs that of course make it easier for everyone to feel comfortable in what they're wearing while they're delivering a much important service. I'm now joined by Dr. Mpho, rather Lihlohonolo Phala. Tell us more about these scrubs. They're innovative, but they're also there to obviously, I think, bring your character to the fore.
Yes, so we make scrubs and uniforms. So our scrubs are mainly to target the healthcare professional, to help them to, because when you look at a person, you don't identify with the scrubs, you identify with the person. So with the scrubs that we make, they're different, they're bold, different colors, different types. So you're able to identify with who the person is outside of the scrubs themselves. So we're trying to accommodate as many people as we can.
And you definitely did not forget about the children.
I didn't. So we have bright scrubs, which make it more comfortable for a child to actually be able to feel like comfortable when a doctor or a healthcare practitioner is treating them. So our colors are bright, bold, beautiful. We also have pediatric scrubs that actually have animals where you can actually interact with the patient when actually treating them or putting up a line or any kind of different procedures to just ease them into the process of helping them.
When we think health, people often think about medicine and, forget about the economic aspect that comes with it, the entrepreneurial aspect. And I think that is what you are bringing to the fore, in particular on the African continent, but linking it to innovation.
Yes, that is exactly what we're doing through our scrubs, because through our scrubs, we are trying to grow globally as well. We're not trying to grow within South Africa. We have started relationships with different other countries where we're introducing them to this concept concept of not wearing plain scrubs. Our favorite saying is that life is too short to wear boring scrubs. So we're trying to actually grow, and not just with the colors, but also with the type of scrubs we provide in terms of making it safer to use in different kinds of facilities in the hospitals, your neonatals, your neonatal wards, your ICUs, and everything.
How's the support like? Are medical professionals happy?
They are very happy. I mean, everyone sees our scrubs and they're like, oh my word, this is very bright. I love it. Because everyone wants to feel comfortable in what they're in. They want to represent themselves well. So people actually do love the products. They love the scrubs as well.
In closing, just tell us about the name of the company and how did you come about with that?
The name is Saba Furaha. My sister, who is also a co-founder with myself, lived in Tanzania for a couple of years. And throughout that time, she obviously learned the language Swahili. So the name Saba Furaha is actually Swahili. Saba means 7, Furaha is happiness. So we aim to have 7 divisions of the company that aim to make the client happy. So that's where the name comes from, 7 joys.
All right, thank you so much. There, of course, Dr. Lehlogonolo Phala, just highlighting some of the innovative products that are being exhibited here at the Africa Health Conference. And as I said, it's not just about the products, and it's also not just about the medicine. They're trying to fuse everything in one. All of this to make sure that Africa's health future is, of course, world class, and some of the best technology products and healthcare practices are cultivated and brought to the fore through this particular conference. It's one of the biggest on the African continent. It is in its 13th year. Yesterday we also saw the first Health Indaba that was launched at this conference. Of course, that is going to serve as the roadmap to Agenda 2063. This as African leaders unite to make sure that Africa's health systems are prioritized. Yesterday, we obviously heard, the MEC for Health in Limpopo, as she was also, making her remarks and also highlighting what should happen. One of the things that she called for was that African leaders should make sure that they prioritize the health systems that they manage, and she wants the Indaba to make sure that they come up with reforms that will force African leaders to get treatment in their own countries, and they should not go to other Western countries or rich countries, but to be treated in their own countries, to respect the voters and get the very same services that they are in charge of.